Administering ophthalmic medication. When administering ophthalmic medication, that is placing an ointment or solution into the eyes of the animal. This may be done for a variety of reasons, but it can include treatment for an eye condition or used prior to bathing or grooming to protect the cornea from damage. A vet assistant or vet technician or even the animal owner can properly administer ophthalmic medication. Step 1 is to wipe any discharge from the patient's eye using a gauze sponge or cotton ball. Step 2, open the end of the ophthalmic medication. Step 3, use your index finger and thumb to pull the upper lid and lower lids apart to open the eye. The thumb will pull the lower lid down and the index finger will pull the upper lid upward, and the other fingers may rest on the head of the animal. Step 4, while resting the hand holding the medication on the head of the patient, apply the drops or ointment gently into the eye without touching the eye, counting each drop or applying the proper amount of ointment without contamination. You want to make sure that that tip does not touch the eye, as it will be painful to the animal, but also will then contaminate the rest of the medication in that tube. Step 5, release the eyelid. And step 6, allow the animal to blink to move the medication throughout the eye.
Hi, my name is Courtney Jones. I'm a registered veterinary technician, and today I'll be properly demonstrating how to administer an ophthalmic medication. This is really easy to do. Anyone can do it, especially an owner at home. That's usually who's going to be doing it to treat an eye infection, an ulcer, some kind of scratch, etc. in the eye. So to start, I do want to clean the eye with a gauze sponge. I want to get all the discharge out. If it's cloudy, just normal discharge or what. We don't want any discharge to be in that eye. And it's very important to know which different types of eye medications we can use and what it can treat. So for example, if we were treating Weston here today for an eye ulcer, we do not want to use any kind of steroid because that can escalate the situation and make that ulcer a lot worse than it actually is. So we can see here we have a dexamethasone sodium eye medication, and if we were treating him here for an ulcer, this would be extremely harmful to that. But today, per our doctor's instructions, we are just going to be applying a simple eye lube to his eye today. So to start, I'm going to open the lid of the medication. And ideally someone else would be holding on to the pet, but he is being fairly well today. So I'm going to lift his head just slightly up, and then opening his eyes, I'll use my index finger and thumb to open up that eye. And then I just want to place a small amount of ointment into his eye, making sure I do not touch the tip of the bottle to his eye, because then we would be contaminating it. I'll allow the animal to blink a few times to spread that medication around. A lot of times what I see, especially with ointments, is it can be bothersome to the pet when it's first applied into their eye, and they'll try and paw their eye. So I will a lot of times blink their eye for them a couple of times to thoroughly coat that eye so that they don't paw that medication out. I'm going to properly demonstrate how to administer ophthalmic medication. I'm going to start by wiping any discharge away from the eye using a gauze sponge or cotton ball. I'm going to open the end of the ophthalmic medication, and I will be using my index finger and thumb to pull the upper and lower lids apart to open the eye. I'm going to use my thumb to pull the lower lid down and my index finger to pull the upper lid upward. Due to the angle, I'm going to be doing this opposite. I'll be using my index finger to pull the lower lid down and my thumb to pull the upper lid upward. And I'm going to rest my other finger on the head of the animal. While resting my hand holding the medication on the head of the patient, I'm going to apply the drops or ointment gently into the eye without touching the eye. I'm going to make sure I do that without any contamination and release the eyelids. I will then allow the animal to blink and move the medication throughout the eye.
In summary, to administer ophthalmic medication, you will wipe any discharge from the patient's eye using a gauze sponge or cotton ball, Open the end of the ophthalmic medication. Use the index finger and thumb to pull the upper lid and lower lids apart to open the eye. The thumb will pull the lower lid down and the index finger will pull the upper lid upward. The other fingers may rest on the head of the animal. Step 4, while resting the hand holding the medication on the head of the patient, apply the drops or ointment gently into the eye without touching the eye, counting each drop or applying the proper amount of ointment without contamination. Release the eye and allow the animal to blink to move the medication throughout the eye.